Hello, everyone, and happy Thursday. My name is Jamie Hinkle. My pronouns are she and her, and I'm the Learning and Inclusion Manager at PFLAG National. Just like every Thursday, we are here for a conversation, and I'm going to bring Jean Marie in to get us started.
Hello, Jamie.
Hi, Jean Marie. It's been a while for me.
Been a while. We haven't been together, and I'm not even at home. My internet went down. I'm actually broadcasting from my sister-in-law's house.
Yeah, I was gonna note that it looks like you're in a different place, different room.
After the hiatus, just find a new space. Yeah. Just take over a new house. So we're going to be broadcasting from here today. Well, we will see you again, Jamie. I'm glad that you're back, and we're going to have a great conversation today. So hello, everybody. My name is Jean Marie Navetta. I'm the Director of Learning and Inclusion at PFLAG National. And every single week we get together to talk about something related to LGBTQ equality and inclusion. And this week we are having a very important conversation. So we are actually using an article that appeared in Metro Weekly by John Riley that was entitled "The American Medical Association Urges Governors to Not Interfere with Trans Children's Healthcare." And the lead on the story basically says that the AMA has warned governors to oppose legislation that seeks to prevent transgender minors from accessing gender-affirming care. And they called such measures a dangerous intrusion into the practice of medicine. And that is a very big and important statement, and we really need to talk about it because there's so much that can happen with that. And to do that, we have an incredible guest today, Dr. Jesse Ehrenfeld, and I want to quickly tell you a little bit about him. He serves on the executive committee of the Board of Trustees of the American Medical Association. He's a senior associate dean and a professor at the Medical College of Wisconsin and at Vanderbilt. He's the co-author of 18 clinical textbooks and a combat vet. He makes me feel very lazy, basically, just reading his bio. But I would love to bring him in to have this conversation with us.
Well, thanks for having me. It's great to be here with you.
Hi, Dr. Ehrenfeld. Thank you so much for joining us. This conversation, I think, is a really important one, and you have certainly been out there talking about these issues. So I really want to jump right into the content because I think we have a lot to cover. So one of the things that I found really interesting about this article and about what the AMA is doing is they really have emphasized that legislation like the one that happened in Arkansas genuinely violates that patient-physician relationship. So can you talk a little bit more about what that entails and what that means for patients in reality?
Sure. So, as you kind of mentioned in the intro, the AMA has long opposed the dangerous intrusion of the government into the practice of medicine, as well as the criminalization of healthcare decision-making. And, political interest of a state lawmaker simply just does not justify infringing on the very sacred physician-patient relationship. And what's worse is that we're seeing efforts to not just prohibit, but to cruelly prohibit the provision of evidence-based care that we know improves the physical and mental health of transgender kids and gender diverse people. And so it is just, it's inappropriate, it's harmful for a state to come in and legislatively dictate that certain transition-related services are never appropriate, to limit the options that I and other physicians have and families have when they're considering making decisions for their pediatric patients. And so, when a state comes in and passes a law like this, it can be devastating for families and for patients trying to make the best decisions, but also can come in the way between a physician and a patient and damage that longstanding and critical physician-patient relationship.
Are you concerned, and are the people who you're working with concerned that what happened in Arkansas is going to set a precedent and we are going to see more of that? I mean, we have over 140 pieces of anti-LGBTQ legislation right now out there in the states, most of which are very intentionally and, to your point, cruelly targeting people who are trans and especially youth. Are you concerned about this setting precedent and perhaps giving other states the idea that this is the path they should go down?
Very concerned. I mean, there's been a spate of bills, close to 30 different ones that we've been tracking, looking to block trans youth from accessing certain treatments for gender dysphoria, criminalize doctors who prescribe treatments. There's a bill that passed the Texas Senate, hasn't been signed into law, that would declare parents who affirm their child's gender identity, even without hormones or surgical intervention, to be guilty of child abuse. It's crazy. Decisions about medical care belong within that sanctity of the patient-physician relationship. And as with any medical intervention, physicians were guided by our ethical duty to act in the best interest of our patients. We have to tailor our recommendations about any specific intervention, thinking about the time of the interventions to the patient's unique circumstances. And those things have to be sensitive to any child's specific clinical situation. Think about their long-term development, balance the need to preserve any kid's opportunity to make important life choices autonomously in the future. And it's harmful for a state to legislatively dictate that something is never appropriate.
Yeah, especially when the people making those decisions that it's never appropriate don't actually have any medical training, which might be the worst part of this conversation. So I want to get into a conversation about the gender, the non-binary nature of gender and the changing understanding of gender. So in an April letter to the National Governors Association, the AMA had asserted that non-binary identities are normal variations of human expression, something that's certainly a PFLAG we've been talking about for a long time. And this is a really important statement as we have more conversations about the nature of gender and how it shows up, and most importantly, how we need to treat people and how we should be behaving. So could you discuss what the statement says, the way people understand it a little bit better? And I'd also love to hear a little bit about the work that got the AMA to that point, because it wasn't just random that suddenly a statement was issued. It obviously took work and research and advocacy.
Well, that's great. So let me just start by saying that the mission of the AMA is to advance the art and science of medicine and the betterment of public health. And as the science and the evidence evolves in any area, we ought to follow it. And that could not be more the case than here when we're talking about our understanding of the medical spectrum of gender. You referenced our letter to the state governors. We went ahead and urged all governors to oppose these legislative efforts that seek to prevent transgender minors from accessing gender-affirming care. Again, dangerous intrusion into the practice of medicine. And we're doing that because our scientific understanding of sex, of gender identity and expression, they have evolved. And we know that transgender and non-binary gender identities are a normal variation of human identity and expression. And limiting access to gender-affirming care can have devastating mental and physical health consequences. And so, for gender diverse individuals, the standards of care and accepted medically necessary services that affirm gender or treat gender dysphoria are critical. And there are clinical guidelines that are out there, and they're established by professional medical organizations for the care of minors. And they support those interventions based on evidence, and it's critical that we stand up for them. Every major medical association that's reputable in the US recognizes the medical necessity of transition-related care because it improves outcomes. It helps with physical and mental health of transgender and non-binary kids.
I thought it was really fascinating that I was reading that the ACLU actually mentioned this position in one of their statements as they were talking about the work that they're doing. So it really did give advocates who are trying to do the right thing on the legal front a nice grounding to work with because of what the AMA did. As this change, as we start discussing gender as more expansive, as non-binary, as in fact a spectrum, as you work with other healthcare providers, do you feel that there is a lot of desire to understand this better? Are people asking more questions than they have in the past? Because it seems that we're having more conversations about this. Are you also seeing this reflected in the medical community?
All across the medical community. And part of our policy that we passed isn't just to affirm that there is a concept that has evidence behind it about the medical spectrum of gender, but also that we take action to educate the physician community as well as our members about what this means and how we can understand patients' needs, their families, to provide them the best personalized, individualized care so that we can optimize outcome and improve the health of the public.
Absolutely. So I really would love to be able to focus on what happens next, because you mentioned that you're following a lot of legislation. We're certainly following legislation. There is a tremendous, I think, environment of fear for many people, because if you look at Arkansas, that was something that the governor vetoed and the legislature actually overrided that veto. So that was a pretty extreme example, but probably not the only one like it. So I want to ask a couple of different questions about what we do next. So we know that in our PFLAG family, we have a lot of different kinds of professionals and certainly a lot of healthcare providers. What kind of things do you think healthcare providers can be doing around this issue in their own areas that would help with this advocacy? Are there any conversations that they should be having? Is there any advocacy that they should be looking at?
Yeah, so obviously the AMA, we're looking along with our partners at every advocacy avenue we have to reverse unfortunate laws like the one in Arkansas and prevent others from taking effect. And so, we have partnered with the ACLU and other organizations to look at legal options to file suits against the implementation of some of these efforts, which we think are inappropriate and unconstitutional. But how do we root these things out at their core? And I think it begins really by improving the shared understanding as a society about what these issues are. And a lot of this, I think, fundamentally comes back to eliminating the stigma around what it means to be non-binary, transgender, LGBTQ+. And we all have a role to play in that. All of us can help to reduce the effects of stigma in America by engaging in conversations, by sharing the message that these are a normal part of human variation. But unfortunately, that's not the case. That shared understanding is not there. There's a lot of misunderstanding, misinformation out there. And if you look at the law that was passed in Arkansas, the title of the law has the word experimentation in it. And I think that is a case in point about how there's this narrative out there that we're experimenting on kids, which could not be farther from the truth. In fact, we have evidence and science that is driving the standards of care that are well established, continue to evolve, and that drive the AMA's position and policy around these issues.
We talk about the standards of care a lot when it comes to talking about trans and non-binary individuals. For people who maybe aren't super familiar with what you're referring to, could you just explain that in a nutshell for people?
Yeah, so there are well-established international standards of care from a variety of organizations. These are not new. These are not fly-by-night. They have been developed over decades, and they continue to evolve, and they are well-established and accepted by the medical community, not just in the US, but worldwide. And they guide clinicians and physicians and teams through helping parents and kids make decisions about what's in the best interest of any individual patient who is suffering from gender dysphoria or needs transition-related services.
And as the conversation about non-binary identities has very much evolved, it's not that it didn't exist, it's just that I think people are having it more openly. Have people been talking about how those standards of care might need to change and get modified as we understand a little bit more about different experiences?
Yeah, absolutely. And, the AMA typically doesn't set standards ourselves. We obviously support a lot of partner organizations across the Federation of Medicine that gets sort of in the weeds about, what the specific protocols look like. But what we will forcefully support is the practice of evidence-based medicine. And, evidence continues to change and evolve. The AMA has been around since 1847. A lot has changed in, the last 150 years or so. And we have to stand up for science. And that is increasingly a challenge, unfortunately, in America today, as we combat misinformation in a variety of areas, let alone around things like, COVID-19 and the pandemic, and support patients and families and the health of the public.
Do you feel that when other professional organizations, whether in the healthcare area, like the Endocrine Society, or some of the more advocacy-based organizations speak up and endorse the work that the AMA is doing, is that helpful? Does that help get the word out? Does it make the knowledge base and the reach that we have bigger? And is that something you would push people, if they are involved in any of these organizations, to try to advocate for?
Well, I think that when professional organizations, particularly medical societies, the AMA, you mentioned the Endocrine Society, and others that are reputable, that are well recognized, that have stood for science for decades, when they stand up for a particular perspective or policy, it holds a different weight than an advocacy organization that doesn't have that particular backing or standing sort of in the healthcare ecosystem. And so it's critically important for all of those organizations across the Federation of Medicine to stand up for trans kids and gender non-conforming individuals, as we have been doing as of late.
So, a question, because we have so many, particularly in the PFLAG family, we have so many parents of kids who are trans, kids who are identifying as non-binary, just as more expansive. What should they do if they approach their healthcare provider and the healthcare provider is either not very knowledgeable or perhaps even resistant? Because I think often parents at that point are acting in a place of a lot of fear, navigating a lot of fear around them, and that can be intimidating. What would your advice be for them?
Yeah, so I think they're two separate issues. There are lots of practitioners in America today who are not experts in this area, and that's fine. It's an evolving space. When I went to medical school, and it wasn't that long ago, I still look pretty young. There was a different knowledge base and a different approach to teaching our trainees about these issues. That's okay. That's a little bit different than an individual who might be resistant to following the evidence and the science. And I think where individuals and parents find themselves probably dictates what they might do in the best interest of their families. And certainly for individuals who just don't have the expertise or the knowledge, that's a different conversation than somebody who might be resistant to following the evidence and what's out there. The good news is there are many, many more freely available professional education resources, including through the AMA's Education Center, which is free for anybody anywhere to get to on the internet to learn about what the latest evidence and science is. And we continue to work with our partners to make those resources more broadly accessible. We have more and more content that's aimed at patients, and we're looking forward to building that out as well.
Great. And, as I think about this kind of these pieces of legislation and sort of the social movement that's leading towards them, I sometimes wonder where it's coming from. It doesn't seem to me to be primarily coming out of healthcare communities. Is that your perception too, that the push for this is coming out of political circles and then it's sort of gaining some momentum among maybe a few healthcare providers? Does it seem like this is the politics pushing the science, a case of politics pushing science very hard?
I think that's a good characterization, and unfortunately, science has become a political issue, and that's just an unfortunate reality that we are experiencing today at this point in America. I hope that science wins, and we know that patients and families will be harmed when political efforts to ignore science win. And so again, all of us can have a role to play to advocate for what we know has evidence behind it, and to stand up for science and evidence-based treatments. And the idea that I could be criminalized or charged with a felony for practicing evidence-based medicine is just counterintuitive and reprehensible.
I was quickly peeking in at our chat, and somebody had raised a question that I think is kind of an interesting one. What is going to happen to healthcare providers in Arkansas? I feel in some strange way like we're at the edge of something that we've never really, we've obviously seen restrictions on certain medical procedures in the past. This isn't the first time, but what happens now? What are healthcare providers supposed to do, and what are the potential consequences for them?
That's a great choice. And I think physicians have an ethical duty to act in the best interests of our patient. And if you look at the AMA's Code of Medical Ethics, which is something that we are very proud to steward, it has evolved over decades and is at the core of a lot of our policy decision-making. Our ethical code actually states that it's important to follow the law, but to advocate to change the law when it's not in the best interests of our patients. And I think that the case in Arkansas is a good example of that, where the law is simply not in the best interest of our patients. And we certainly look forward to standing with many of our partners to try to reverse those actions through every mechanism that we have that are available.
Thank you. And it really is very scary to think of this, knowing what we know, the connection between appropriate healthcare for trans and non-binary youth and not getting it. The idea of it not being able to be provided gets very frightening. Could you actually talk a little bit about, because I think, a lot of people who are very deep into this conversation know what is at stake for these youth, but can you talk a little bit about what we know about when trans, non-binary, expansive youth particularly are denied these kinds of healthcare, or when they don't have access, what is at stake? Because we know it literally does come down to lives.
It does, and unfortunately, trans kids are up to 3 times more likely than the general population to report being diagnosed with mental health or substance use disorders due to stress, stigma, isolation, discrimination, and that stress poses substantial risk to trans youth, and unfortunately prompts many of them to consider suicide. But there is hope. We have a growing number of studies and evidence that clearly show that having access to gender-affirming care reduces rates of depression, reduces anxiety, reduces suicidal ideation among patients, and leads to better, improved overall outcomes in mental and physical health. And so, trans kids, like all kids, have the best chance to thrive when they are supported, when they can obtain the healthcare that they need. And so it is imperative that transgender minors be given the opportunity to explore their gender identity under the safe and supportive care of a physician. And we all have a role to play to stand up, to advocate for the best care possible, to oppose laws like the one that was passed in Arkansas that, again, as we started the conversation, represent a dangerous intrusion into the practice of medicine.
Do you think that other professional healthcare organizations, so professional organizations representing healthcare providers, will become more involved in this fight? Are you getting indications sort of from other corners that this isn't just something the AMA is speaking about on its own?
I certainly do. And we've seen letters from a number of other organizations, to a variety of stakeholders, legislators, governors, other individuals on these issues. And I think there's a growing awareness that it's really, really become critical for the House of Medicine across the Federation and many of our partners to stand up.
I feel like this, the fight that is sort of bubbling up here feels a little bit like removing homosexuality from the DSM, that it's probably going to take a whole lot of people in a lot of different walks of life to actually make this happen. We actually have a question from one of our viewers who was asking what the best resources for finding gender-affirming medical professionals for people who are looking. So if there are families or young people or actually anybody who's looking for medical professionals who will provide good care, do you have suggestions on where to start?
Yeah, absolutely. The good news is that there are a growing number of centers of excellence all over the country that have multidisciplinary teams, which the standards of care and the guidelines now recommend lead to the best outcomes. That's not always possible depending on where people live. They just may not exist. But I will tell you that with telemedicine, there is no silver lining in a pandemic, but we have seen better access to care across the country for many LGBTQ plus individuals and their families through the advent of telemedicine. And so there are lots of individuals that I'm aware of who've been able to access some of that more specialized care in ways that wouldn't have been possible even 2 years ago because of the advent of virtual care and remote visits and those kinds of things. There is an online database that the GLMA Health Professionals Advancing Equality maintains. The AMA doesn't endorse that, but it is a resource that's out there. And certainly there are plenty of centers of excellence across the country that parents and families can look to either for direct services or referrals in their area if they're trying to find something that is more locally based.
Thank you. We had another question, and it had to go with the heart of individual advocacy. Is there anything that you think sort of the everyday patient can be doing with their healthcare provider to emphasize the importance of inclusion? And I'm not specifically just talking about in terms of trans healthcare, but also across the board. So you walk in to do your doctor's visit, starting with your intake forms, for example. Is it appropriate, and is it something that you think people should be doing? And can you give a couple of suggestions on ways to cue up that conversation with your healthcare provider?
Yeah, no, that's a great question. So it starts with having an open, honest conversation with the healthcare team. And I get asked all the time, how do I come out to my doctor? Is it important for me to come out to my doctor? As a parent, should I support my child coming out to my doctor? And I think the answer is yes, 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 all of the above. I can't provide the best personalized care for the patient in front of me if I don't understand their sexual orientation and gender identity. And so, it's important for physicians to ask those questions and for patients to volunteer that information. I think more practices are getting better about routinely asking those questions and making it easier for patients to volunteer that information. Not everyone is there. If there's a gap, point it out. And, I would say that most practices and professionals welcome that feedback. Often it may be the first time that they've thought about it. And I will tell you, my husband and I, we've got a gorgeous 2-year-old son, and we had an experience with a practice where the form said mom and dad, and crossed it out and mentioned to the team that maybe it was time to update their form, and they were like, thanks for pointing that out. How did we miss it? And they changed it in a bunch of other places, but it just got overlooked. So I think that standing up for equality in small ways is just as important as many other ways that I think parents and families are thinking about advocating.
You did mention the pandemic, and we've actually talked about that pretty extensively and the impact that it had on the LGBTQ community. We know that it took an enormous toll when it came to mental health. We also saw that the impact trickle down into physical health too, because there was obviously that very tight connection. Could you talk a little bit about what you saw and maybe what people should be watching out for as we are sort of moving, well, sort of a little bit moving out of where we are now, even though there are days that I'm not sure?
Yeah, well, I think that the pandemic has shown a light on existing healthcare disparities that have been long documented, but were just exacerbated by the gaps in care, the delay in services. And, one of the challenges that has been very obvious to me from where I sit is around data collection. We just do not have the data today to really understand at a granular level things like, what's the vaccine uptake rate in the LGBTQ community, because those data simply are not routinely collected in data systems. That's a huge gap, let alone who's getting COVID and how people are doing. And so there is movement to try to change those things, and there's some promising activity within the Department of Health and Human Services at a federal level to start to push out some data standards that would make it easier for offices and healthcare systems to collect and track and share those information. But right now we continue to fly blind in a lot of places around understanding the quality of care that's delivered, how care is delivered, and what the impact is specifically to LGBTQ plus individuals and their families.
I think that I appreciate that you brought up the question of data collection, because that was one of the very big challenge. I mean, it's always been a challenge. It continues to be a challenge. It got particularly bad in the last administration because of changes that were made. Can you talk a little bit about what happens very specifically? Because I don't think people always understand that not having data really prohibits us from doing a lot of other things. Could you just speak about why that data collection is so important, and maybe give an example or two of the kinds of information that we need so that way other advocacy can happen?
Well, absolutely. I'll give you a great example. So when we don't have data, populations remain invisible. And then resources are not directed to solve problems that are there, but they just are not recognized. And I'll tell you, we know that, for example, the VA administration does not collect gender identity and sexual orientation on something like 95% of veterans. And yet we know that transgender veterans are more at risk for behavioral health challenges, suicidal ideation, and suicide. So how do we target high-risk populations that we know are there but remain invisible because we don't ask the questions? It's a relatively straightforward problem to solve. We haven't connected the dots, and there's a real opportunity to move that forward through collection of data in more routine ways across all clinical care settings.
And I think that's a place where people actually can advocate, because there are questions, people make decisions, and there are opportunities to weigh in on things. I know that I've seen lots of opportunities for public comment on data collection projects at a federal level, but it seems so esoteric. I feel like sometimes people don't understand this very strange thing actually leads to the resource that actually probably will save somebody's life.
Couldn't agree more. And I will tell you that the problem is often with healthcare professionals who are reluctant to ask questions. There's been study after study after study that show that patients are happy to answer them because they understand that it leads to better care. And so I think the more that we can do to help practices and professionals become comfortable answering these questions by volunteering your identity and your orientation and coming out, it'll be easier to move this ball forward.
Thank you for saying that. That was something I never even thought about, because I always sort of think about onus on the patient, but the questions do need to be asked too, and we can all advocate for those changes. We are just about out of time. I want to thank you so much, Dr. Ehrenfeld. This was such a great conversation. Thank you for indulging my data nerd tendencies. Thank you for everything that you're doing. And please, if we can ever do anything to help advocate, let us know. Everybody, we are out of time once again, but thank you so much for joining us for a very important conversation. We're going to have a good conversation again next week. Hopefully I'll be back in my own house with some working internet. But until then, we close out the same way every single time. We first of all encourage you to run fast, to laugh hard, and to be kind. And please, please, please go get vaccinated if you haven't gotten vaccinated already. Encourage the people around you to do it. And please continue to behave responsibly so that we can all be together in a room sometime soon. We will see you again next week. If you need any help, please visit pflag.org today. Thank you, everybody. We'll see you soon. Bye.